Hi guys, it's Dr. Adam here. If you've had a knee replacement and it's painful, you might be wondering why this is the case. In this video, I'm going to run through some common causes of pain after knee replacement surgery. Sometimes working out the cause of pain is far from straightforward, so the video isn't intended for you to self-diagnose your problem, but so that when you speak to your surgeon, you're better informed, have a clearer understanding of what might be going on, and you're not confused as to why they're suggesting certain investigations or treatments. I hope you find this video helpful, and please remember to hit subscribe. As always, this video is for information purposes only, and you should speak to your surgeon before making any decisions about your care. Okay, the first cause of pain to rule out is infection. This is one of the most feared complications of knee replacement, and in a previous video we spoke about what you can do to reduce the risk of this. Now, the reason why infection is so devastating is that the body's immune system finds it really difficult to clear infection from the surface of implants. The bacteria form a sticky layer called a biofilm that literally coats the implant surface. So once it takes hold in a knee replacement, you tend to be stuck with it. And unless the infection is only superficial around the skin and soft tissue and it hasn't gone into the knee joint, antibiotics alone can't clear it. Now, infections can present in different ways. Sometimes the knee can swell up quickly and be really painful, and it's obvious that something is wrong. There are often skin changes, or you may even have discharge from the wound. This can happen either in the weeks following surgery or after many months or years when the bacteria find their way into the knee through the bloodstream. And often, what happens is when you have a coexisting infection somewhere else in your body, such as a chest infection, or urinary tract infection, or dental infection, the bacteria seed off into the bloodstream and they can travel and settle within the knee. But infection can also present in a more subtle way, with background low level pain, sometimes over many years, that just doesn't seem to settle. The first thing to do is try and diagnose the infection. This is done through a combination of the history, the examination, blood tests, including your white cell count, and inflammatory markers such as CRP and ESR, and the imaging. Now, the imaging usually always includes plain x rays and sometimes a type of CT called the SPECT CT scan or other imaging. And the surgeon may also want to aspirate the knee. And the idea behind this is if they put a needle into the knee and draw out some fluid, they can see if that fluid grows any bacteria. Now, it can be really difficult to diagnose infection, but some of the red flags that should alert you are if there's a problem with the skin or the wound, and particularly if you have any discharge or an increase in swelling around the knee. The other thing that should alert you is an increase in pain, which can happen at any point following surgery. If you're worried, the best thing to do is to see your surgeon, and they might just reassure you and say, look, the wound is healing as I'd expect it to at this stage following surgery. Or if they are worried, they can arrange further investigations as needed and then speak to you about the treatment options. In another video, we'll go through what these treatment options are for infected knees. The next cause of pain is what we call aseptic loosening. And by aseptic, what we mean is that the loosening is not caused by infection. So, what does cause it? In a knee replacement, between the two metal components, there's a plastic spacer made of polyethylene. Over time, this can wear out, and when it does wear out, it creates debris that triggers the body's immune system to actually start resorbing bone around the implants. So the implants loosen, and because they're not well fixed and are rattling around, this is painful. Now, aseptic loosening usually, although by no means always, occurs around 10 to 15 years or more after the knee replacement, as over this period of time, the polyethylene slowly wears out, but sometimes it can happen sooner for a variety of reasons. The next cause of pain to consider, which is surprisingly common, is pain from outside the knee. Pain in the hip or the back can cause what we call referred pain to the knee, where the nervous system essentially gets confused as to where the pain is coming from. If there's uncertainty about this, you might need investigations on your back or hip, or possibly even a diagnostic injection. And the idea behind this is that if you have an injection into, for example, your hip joint, and your pain in the knee gets a lot better, then it tells you that the hip is a pain generator. The next cause of a painful knee replacement is problems related to the patellofemoral joint. This is the joint between the end of the femur or trochlea and the underside of the kneecap. Malrotation or oversizing of the knee replacement implants can cause this, as can degenerative changes in the cartilage on the underside of the patella if it hasn't been resurfaced during the knee replacement surgery. The next cause of pain is soft tissue problems. Although we tend to focus on the implants, a lot of the pain following a knee replacement is caused by irritation of the soft tissues. The patella tendon can become inflamed, causing tendinitis. Ligaments can be irritated. The muscle, bursa. Sometimes the implants themselves can be irritating, and sometimes it's not entirely clear, but could be due to changes in leg alignment after surgery or just the body's reaction to the operation. Next up, we have neuropathic pain. Now, this is essentially an overreaction of the nervous system to the body being injured. It can either be localized to a neuroma, which is often in one spot, usually along the site of a scar, or generalized pain, which can ultimately lead to CRPS or complex regional pain syndrome. Now, this is really difficult to treat and something that doesn't need surgery, but management by a specialized pain team to help desensitize the nerves. Of course, breaking the bone or a fracture can also cause pain, and sometimes the cause of pain isn't entirely clear. I usually tell people that of everyone having a knee replacement, around 80% of people are happy with the outcome. 5% are unhappy and have a serious problem, but there's 15%, which is quite a reasonable chunk of people, who are not completely satisfied in one way or another with the knee replacement, and they may have ongoing pain or stiffness or instability, and sometimes this is a mystery. The knee replacement looks perfectly well done technically, and everything else appears to be fine on the x-rays and on examination, but the person just still continues to have some pain. We're not entirely sure why this is the case, but what we do know is that the knee is a complex joint with sliding, rotation, and bending and straightening movements, and trying to replicate this with metal and plastic isn't reliable.